With cold and flu season also starting to rev up, preparations are underway here in the GTA for vaccine rollouts. And this year there will be a push to make getting the jabs as easy as possible.
Probably going to be in for a rough flu season ahead. And it's that whole triple demic. We know that COVID cases are already on the rise.
Health experts say there is a window of time right now for Ontarians to roll up their sleeves and gear up for what's to come. It appears we are seeing a more usual start to cold and flu season, with bigger spikes and waves expected later this fall.
This time last year, we were around sort of 8,000 cases. Now this year, we're about 1,500. So that gives you an indication of where we're at. And we've also had multiple boosters and a whole range of other things. So we're in a much better position right now.
The Ministry of Health is welcoming the new COVID vaccine approval and says when supply touches down in Ontario, it will be working with public health units and sector partners to ensure needles get into arms as soon as possible. The rollout will likely begin in early October. Toronto Public Health telling City News it will be working in collaboration with hundreds of pharmacies and primary care providers across the city and will be rolling out an equitable and effective program. The language surrounding COVID shots is also starting to change, with Health Canada officials moving away from the word booster and shifting to updated vaccine.
It kind of feels like this is the beginning of the vaccine becoming like the flu shot. Every fall, we're going to get the updated version. That's the best match.
So I think that's the way we have to sort of see this now playing out. Even though the federal government isn't saying that we're there yet, my sense is that we pretty much are there.
After a dramatic drop in the number of people who have been beefing up their immunity, there is also a push this year for health agencies to link their campaigns for flu and COVID vaccines.
You can actually get both your COVID and flu vaccine given to you at the same time. So instead of going back to your doctor's office or your pharmacy for two separate trips for two separate vaccines, it is absolutely safe to get them both at the same time.
If you have to ask people to come back for a second thing, they're not going to do it.
And for the very first time, an RSV vaccine for the 60-plus crowd will also be in the mix. Details on all of this will be made available in the coming weeks. Shauna Hunt, City News.